Allow me to introduce myself briefly and concisely. My name is Professor Karl-Axel Hartmann. I am 56 years old, father of 3 grown-up daughters, and have been the chief medical physician here for almost exactly 20 years. I previously studied in Marburg, which is a charming small university town in the beautiful region of Hesse, then had stints in England and Denmark, completed my specialist training at the University Hospital in Düsseldorf, and spent 2 years in Amsterdam, in the Netherlands, on a research fellowship. The focus there was on oxygen research. The clinical focuses I have developed here are essentially breast carcinoma, but also gynecological tumors, and more recently, we have been doing a lot of stereotactic treatments in the body trunk area, as well as in the brain. This has also become a key focus of our clinic, and we are continually expanding our expertise. I can say a few more words about the clinic. We are indeed one of the largest centers in Germany, equipped with 3 highly advanced, state-of-the-art linear accelerators, all calibrated the same and dosimetrically identical, which means that we do not experience equipment failures. If a device fails, complex medical technology here, another device can take over, so that there are no interruptions in radiation therapy. It is important for the effectiveness of an oncological treatment to have a high level of structural security. In addition to the 3 linear accelerators, we also have an additional linear accelerator also in the operating theatre. These are a few special indications, such as breast cancer, and also specific carcinomas in the pelvic area, where it can be indeed very advantageous to deliver high dose intraoperatively to the exact location where the dose is truly needed, for example. In addition, there is a brachytherapy unit. Brachytherapy means we have short-acting radiators, which is very important in the treatment of cervical cancer, and we are also technically at the cutting edge in this area. We can perform so-called interstitial treatments, which means that the radiation is not only delivered into preformed body cavities, but can also be specifically targeted into the tumor via needles. This increases precision, sparing of healthy tissue, and also the chances of recovery in such situations. Radiotherapy today requires a lot of personnel. We have 8 doctors and 7 physicists. Radiotherapy has become so complex and technical that, for what one wants to achieve today, there must essentially always be an almost 1-to-1 ratio between physicists and doctors. Physicists, as we will see shortly, are responsible for radiation planning, but also for quality assurance. For example, the equipment is precisely measured every morning. Maintenance is carried out in larger cycles. So, a lot of quality assurance is done in the background to ensure that a consistent dose is administered to the patient. And in Germany, everything is definitely and absolutely prescribed by DIN standards, which are, of course, also met. And that nowadays requires a significant effort from the technical staff. And you need a high number of personnel for that.